All right. Hello, good afternoon. Welcome to our fabulous webinar in honor of the National Human Trafficking Awareness Month here in January. We're going to get started in just a few minutes. So hang out, get yourself some water, some tea, something, have some coffee talk, and we will get started in 2 or 3 minutes. Does everybody know that character? Linda Richmond. P.S. If you look her up, that is exactly what my grandmother, my dad's side, looked like until the day she died.
I love it.
Kind of frank.
Amazing.
All right, so just give us a couple minutes. We have people coming in, and we'll get started. 12:04. Actually, let me shut off my email because if I don't, then we're going to get notifications all the time.
You can also use the focus do not disturb button to just shut out anything from popping up.
Is that on the email or on Zoom?
On your regular computer, all the way at the top. Do you have an Apple?
No.
Oh, then it's different. But there's somewhere a do not disturb button. Just good to know since you do so much public speaking.
That's a good thing to know.
And it just, no texts, no emails, nothing will pop up. No news alerts.
So instead, I'm just going to close it. Okay. 17 people rolling in. Fabulous. Saint, I managed to, of course, find a spot on the street today.
Very impressive, honestly.
I take parking as a personal challenge. In New York, I don't like parking garages. I feel like it's a sign of weakness to park in a parking garage. So it's like ingrained to me. Like my father would drive around, like when we would, because I didn't grow up, I moved into New York City right after college, but I didn't grow up there, but my parents would take me all the time. And so when my parents would drive in, my mom would be like, we could just park in the garage. And my dad would be like, no, we will not park in the garage. And
as a point of principle.
As a point of personal pride more than anything. So
Yeah.
I have that in me, and I hate parking in garages as a point of pride. And there was like one spot cleared out, and of course I would take it.
Nice.
All right, it is 12:04, and we are going to get started. I would like to welcome you this afternoon to our webinar entitled How Decreasing the Nation's Social Safety Net Increases the Risk of Trafficking and Exploitation. My name is Jessica Emerson, and I direct the Human Trafficking Prevention Project, which works in partnership with and it's not with Maryland, the Volunteer Lawyer Service, and my partner in crime, Heather Hyman. Would you like to say
hello, everyone? Welcome.
And everyone in between. And with us today, we also have St. Aubin, who is our legal advocate.
Hello.
And Saint is going to keep an eye on the question and answers and chats and all of that, because we definitely want to hear from you today. And before I introduce our panelists, I just want to tell you why we thought that this was an important discussion to have in this month of Human Trafficking Awareness Month. This was something that we have been talking about internally for a very long time. As everyone knows, in the past year, a lot of the federal and budget legislation has really centered on significant cuts to programs like SNAP and Medicaid and TANF and housing assistance. And really absent from the discussion, or silence from the discussion, has been the impact on human trafficking survivors. And we wanted to make sure to bring that front and center today. And there are no two people that I know who can help us understand this landscape, both its history, its current functioning, and quite honestly, what we are going to see when these cuts, or as these cuts are starting to grow into effect, and what is coming, as well as some things that we as Marylanders can do and can look out for going forward during our legislative session. So I want to introduce Michelle Medeo. Her pronouns is an attorney with the Public Justice Center's Health and Benefits Equity Project, which engages in advocacy, direct representation, and community education to protect and expand access to healthcare and safety net programs. Now, prior to joining PJC in 2025, how Heather and I and Michelle knew her best was the Director of Economic Justice at the Homeless Persons Representation Project, where she represented hundreds of individuals and families, many of our clients, in appeals to access temporary cash assistance, temporary disability assistance programs, supplemental or SNAP and Medicaid, partnering with families directly impacted by public benefits and housing insecurity. Michelle advocated for policy reforms to make Maryland's public benefit programs easier to access, more equitable, and to end many of the racist, oppressive, and punitive programs at the root of safety net programs. And I also worked with her in that legislative sphere as well. So welcome, Michelle. Now we have another Michelle with one L, Gilman, who is the Venerable Professor of Law at the University of Baltimore School of Law. Shout out to my alma mater. She directs the Civil Advocacy Clinic, where she supervises students representing low-income Baltimoreans in cases involving housing, consumer, and public benefits law. She also teaches evidence and admin law, and co-directs the Center on Applied Feminism, which works to apply feminist legal theory to legal practice and policy. Michelle is an expert on social welfare issues and writes about the ways that technology impacts low-income communities for both academic and public audiences. Now, I can't help but say that without Michelle Gilman, there would be no HTPP, because when my funding through the Equal Justice Project ran out back in 2025, 2015, Michelle agreed to take on the Human Trafficking Project as essentially an incubator clinic within the Civil Advocacy Clinic, and taught me how to teach and taught me everything I know about exterior illumination. No, I'm just kidding. Sorry, that was a nod to a Christmas vacation. But really took the project on and encouraged me to make it what it is today. And so, Michelle, thank you so much from the bottom of my heart, because without you, there would be no this. So welcome to the both of you. What we are going to do today, just to give you all a roadmap of what to expect, Michelle Gilman is going to start us off with a history of social welfare programs, helping us see how they started, how some of the stereotypes and discrimination within the programs, kind of where that comes from, and help us understand how much they really do help. And then we're going to segue into Michelle Medeo's presentation to help us understand how much HB1, or the big, very non-beautiful bill, is going to impact all Americans. And then we're going to take a pause before Michelle starts talking about some legislation, or kind of winds us up talking about some legislation that we should all be on the lookout for. We're just going to have a little bit of a group discussion about how these changes could impact everyone and make them more vulnerable, or put them at higher risk than they were before of trafficking and exploitation. We encourage you to use the Q&A. Saint is going to be keeping an eye on that. Will interrupt us if it is kind of in the right timeline. We should have some time at the end of things to take some questions and answers. We hope that this material challenges you and gives you some fodder for folks that maybe don't have the facts straight. So from here, I want to turn it over to Michelle Hillman. Thank you so much for being here. Really appreciate you, just generally speaking. Thanks so much for being here too.
All right, thanks for having me. Thanks to HTPP and MVLS for sponsoring this conversation where we are going to make sure that our knowledge and our advocacy is centered on facts, which in today's environment is more important than ever. So with that, I'm going to share my screen because I have a lot for everyone to look at so that we can better understand poverty and the safety net. All right. Is my image clear? Can you just give me a thumbs up? Okay, good. Okay, I'm going to show you some photos right now that are difficult to look at because what we want to do is think about a lot of myths around poverty in America and how to debunk those. And one myth that can permeate discussions around poverty in our country is that we don't really have poverty. And that idea comes from the fact that there are places in the world like this with these very painful photos where there's widespread famine, there's stunting of children's growth. We don't have poverty on that scale in this country. And that leads some people to say, yeah, we don't really have poor people in America. So these are some representative quotes from policymakers and think tanks about who they think deserves help. We have statements that low-income Americans are just spending their money on booze or women or movies, that people should invest in their own health care rather than getting iPhones, that because an average poor person can afford air conditioning, a car or truck, cable or satellite TV, we don't have poverty in this country. We have the assumption here from Senator Manchin that people aren't making effort to help themselves. So this is a lot of the representative chatter around poverty in America. But I think we have to consider that, in today's world, a smartphone is not a luxury, right? It's basically a digital mailbox. It's a mandatory portal for job applications, banking, school portals, telehealth, and more. Even just think about air conditioning in our changing climate.
It's an alarm clock for kids to get up for school.
It's everything. It's how we function in modern life. Yes, thank you. That's so true. Air conditioning isn't a perk in an era of climate change. It's a basic health requirement for our elderly and most vulnerable citizens. And, here we also have to note that just owning a low-cost device, it doesn't pay the rent. It doesn't prevent eviction. Okay. In modern American society, the cost of consumer goods has fallen dramatically, but the essentials like housing, healthcare, childcare have outpaced wages for decades. Okay. We do have hunger in America. We have people who go to bed without eating adequate calories for the day. So this is data gathered by the U.S. Department of Agriculture on food security status in America, and 13.5% of households are food insecure, meaning that at some time during the year, these households were uncertain of having or unable to acquire enough food to meet the needs of all their members because they didn't have enough money or other resources for food. And we have some families here, 5.1%, with very low food security. And that means their normal eating patterns were disrupted and food intake was reduced because they had insufficient resources for food. These are people skipping meals, people who report they didn't eat in a given day. And so these are the different indicators of food insecurity that USDA surveys. And you can see the households with the lowest levels of food security report more often these types of shortages of meeting their needs. One thing I'm sad to report is that under the Trump administration, the USDA is going to stop gathering and reporting this data. So this is probably the last snapshot we're going to have for a while. Advocates around the country are very upset about this. I even saw a blog from the Heritage Foundation, a conservative think tank, taking issue with the Trump administration's decision to stop reporting it. Just because you don't report it doesn't mean it isn't happening. We also have people in America living without shelter. More Americans are experiencing homelessness, as this slide shows. And so if poverty is failing to meet basic needs like food and shelter, we have poverty. It may look different than in sub-Saharan Africa. I acknowledge that, of course, and we're fortunate about that. But we have to look at the society in which we are based, because there's a relative notion as well when we think about whether people are meeting the needs for the society that they live in. Okay, the second myth I want us to talk about is this idea that if you're not officially poor, you're doing okay. Under the official poverty line, which is generated by the Census Bureau, 10.6 million people were poor in 2024, which is our most recent year of data. And this amounts to 35.9 million people. Now, of course, poverty rates vary by race, gender, and age. This particular slide shows us that poverty rates vary by race. The highest rates are with American Indian and Alaska Native populations, and the lowest rates are among white populations. And so while more white people are poor because there are more whites in America, you can see that poverty disproportionately hits different racial groups. This slide shows the U.S. poverty thresholds. So these are the actual poverty lines that the Census Bureau uses in its calculations. So look, for example, for our four-person household, folks earning less than $32,130 a year are considered poor and calculated into our poverty statistics. But this means if this household is making $32,131, they're not considered poor. And that's sort of ridiculous because we know that family would be very much struggling. Now, how is the Census Bureau even calculating this line? Well, it's based on 3 times the cost of a 1963 minimum food diet updated for overall inflation each year. And this measurement may have made sense in 1963 when it was designed. At that time, food was the largest part of a family's budget, over 1/3. But now, food is only about 1/7 of a family's average budget, and housing is the largest cost for the vast majority of American families. Nevertheless, this measurement from 1963 is still the basis of our official poverty line. Now, this has been widely criticized by economists, policymakers, and others because of its shortcomings. And so since 2010, the Census Bureau, at the same time that it issues the official poverty measurement, also issues what's called the supplemental poverty measurement. Okay. And this measurement uses thresholds based on a standard of living that takes into account expenditures, not just for food, but also clothing, shelter, and utilities. And then to determine a family's resources, income is supplemented to include benefits like food stamps, housing subsidies, and tax credits. And then deducted from that amount of family income are medical out-of-pocket expenses, income and Social Security payroll taxes, child support payments, work-related expenses, and childcare costs. So it's trying to get a richer and more accurate number of what families are actually living on. And unlike the official poverty line, it is adjusted for regional cost of living differences because, as we all know, it's going to be more expensive to live in New York City than rural Nebraska. And the supplemental poverty measure takes that into account. Now, you may also have heard of the poverty guidelines. That's something different. That comes from the Department of Health and Human Services. It's basically a simpler version of the poverty thresholds, and it's mostly used by federal agencies to determine eligibility for public programs such as food assistance. So when you hear poverty guidelines, it is different than the poverty thresholds. Now, back to the supplemental poverty measurement. That measure is at 12.9% for 2024. So it is higher than the official poverty measure. And also, like the official poverty measure, it does vary based on race, age, gender, and disability. And the Census Bureau reports on that, and you can easily get those statistics.
So am I correct in assuming that no administration would want to officially make the switch because then they would essentially inherit a ton more official poor people?
You are right that the political incentives are not in favor of adopting the supplemental poverty measure as the official measure, but it is reported every year side by side with the official measure. So at least we have that information available to us when we're making other policy decisions, including where to set eligibility standards for different public benefits.
That's what I was going to ask. So which one is used to set standards for SNAP and like the things that we use?
Those are the HHS guidelines, which are based on the official poverty measure roughly. But normally people are eligible for public benefits at certain percentages above the guidelines, like 100% above the guidelines, 150, 200%. The federal agencies recognize that a lot of people are struggling, even if they aren't below the official poverty line. And that's what this slide gets to. We have almost 15% of the population in near poverty. Okay, these are the folks who aren't under the official poverty line, but they are still financially vulnerable, right? They're often relying on public benefits like SNAP or free school lunches to make ends meet. And because eligibility is set above the official poverty line, they do qualify for those benefits. Even though they're not considered poor, they still qualify. And so often that group is called the near poor. Okay.
But
so those are
this gray area. We're talking about a lot of variation.
Yes, from billionaires to people like making the median income in the United States. Yes, that's a vast group.
Struggling a lot now because food costs are so high and rent costs are so high and all of that. So, I don't want people to look at this gray thing and be like, oh, all these people are just fine, because they're not.
That's right. And that's a really important point. And that's why there's even a better way to assess can people make it in this society? And that's through the self-sufficiency standard. And on this slide, this shows the self-sufficiency calculation for a family in Baltimore City with one adult, one infant, and one school-aged child. And the idea of the self-sufficiency standard is that it's looking at what it actually costs to live by your household size in a particular jurisdiction. Okay, so it defines the income that a working family needs to meet their basic necessities without public or private assistance. And when they're looking at basic needs, you can see those listed here from housing, childcare, healthcare, and on down. And there's no luxuries in this basic budget, right? This isn't a Red Lobster AMC Cinemas budget. These are just your basic needs. And the standard has been calculated for 719 different family types for each county or area in a state. And you can see here that in Baltimore City, to make it as this three-person family, the hourly wage needs to be $37.93. Okay. And I know that is not the hourly wage of my low income clients or Michelle's low income clients or the people that we all work with. That's an annual wage of $80,099 just to make it without any forms of assistance. And I feel having these numbers and being able to like grab them at your fingertips is a very powerful tool when we're in Annapolis or in DC advocating for enhanced benefits for our clients because it focuses on a living wage. And you can see
living with your family if people don't know their facts.
Right. And if you want to look up your own county and your own family structure, if you just Google self-sufficiency standard for Maryland, you'll go right to the website and it's very easy to input your family structure and your county. I mean, this is the slide for Baltimore City. If I put up the slide for Montgomery County, the hourly wage necessary is like over $60. So it varies within our own state, and we're fortunate to be able to have that breakdown. So
Michelle, are these even, I'm just looking at the bottom of the slide where it says it's based on the self-sufficiency standard for Maryland from 2023. Are these still a couple years behind as well? I'm just
I
thinking
think,
about the incredible inflation we've seen in the last few years, the rise of housing costs, the exponential rise in healthcare costs, because it's mind-blowing.
Yeah. I'm pretty sure this is the most recent set, and it is updated regularly. But all of this type of data around poverty measurement is always going to be like based on numbers at least a year behind, right? So like when they report the poverty line for 2026, it'll be based on 2025 data. Like that's just how the data gathering process works. And this the disjointedness between this hourly wage and what like our federal minimum wage of $7.25 is very vast. In Maryland, we do have higher minimum wages than that, around $15, can also vary by jurisdiction, but still not enough. Still
half of what is needed in Baltimore City. So I'm thinking what we'll do for a couple of these kind of easily accessible websites is when we send around the surveys for this webinar, we'll send, for a couple of these websites like this one, we'll send this around as well. And I think I'll also send, there's a a great little kind of piece on this from the West Wing that talks about this that I love when I've seen.
I'll send you all that, Jess.
Yeah, I would.
So you can include it.
Yeah, so folks can just watch it. There wasn't really enough time to do that today, but there's a like 10-minute clip from the West Wing that just goes into this in a perfect fashion that I think everyone will just kind of scratch their head on when you get a chance to watch it. It just ties this stuff together perfectly.
Yeah, I'll definitely send that to you. Okay, so let's talk about myth number 3. And just so you know, we have 5 myths we're talking about today in case you want to know where we are in the conversation. Okay, this myth is the idea that we lost the war on poverty. Okay, not true. Yes, we still have poverty. Okay, but it would be significantly worse without our social safety net. And this slide shows some of the available forms of assistance and the rates at which they're taken up in the population. And these different programs keep a lot of people above the poverty line and meeting basic needs. And you can see our largest programs in terms of population share are both Social Security, which helps our senior neighbors and friends and family, and the healthcare programs. And you can see that our welfare program is in the middle here. It's called Temporary Assistance for Needy Families, and it's the smallest on this slide. It's quite tiny. It's very important for families who get it, but it's sort of rhetorical impact in public discourse far outstrips the actual size of the program and number of families who receive it. Okay, as I said, these programs have an impact. And this slide shows us the millions of people lifted out of poverty based on the program. And our greatest anti-poverty program is Social Security. Again, that benefits our elderly. And you can see here just how impactful each one of these programs are. Many of these were set up in the 1960s by President Johnson and his Great Society, and they cut poverty in half at that time, both for adults and children. We also know that public benefits programs can more than pay for themselves. And before I get to that, you can see how impactful our safety net has been here in Maryland. Okay, so for every dollar increase in SNAP benefits, there is $1.70 in economic growth. So this is what I mean when I say these programs pay for themselves. And there are even more benefits to individuals and communities. So SNAP participants report better health than eligible non-participants. Isn't that amazing? If you can eat and gain nutrition, you're healthier than if you're struggling, skipping, and missing meals. Children with access to SNAP.
Can you go back to the slide with the dollar bill on it?
Yeah.
I think that's really key because the stereotype is that these programs and the people on them suck from the government.
Mm-hmm.
And this is saying the exact opposite. This is saying that for every dollar increase in benefits, there is $1.70 in economic growth overall.
Yeah, and this is not a disputed number.
Yeah.
This is a fact. Okay. And even think about when people report better health, that saves on healthcare costs, right?
People are better able to work. They're better able to focus at their jobs. They're better able to focus in school and all of those things. When people are hungry, you can't function. I mean, we talk about that when we work with folks who are, coming to our law offices for things, that when you offer folks a water and a granola bar, they are probably going to be better able to communicate with you about whatever it is that you're there to. I mean, we've had this conversation with a billion students, right? Because when folks are hungry, they are not going to be able, they're in their own way in fight or flight because their body is running on fumes, right? So the same occurs to me with a job and with being in school and all of those things. So everything works better when people are not hungry.
Absolutely. We know that children who have access to SNAP fare better years later. Again, like Jess, you're talking about, the ripple effects go into multiple realms far beyond just having food on your plate. We know that a SNAP participant incurs $1,400 less per year for healthcare because, again, they are eating gives you energy, eating helps you exercise, work, go to school, engage, be a more productive member of your community. And while we are talking about the economic benefits here of public benefits, we also need to recognize that it's not just poor people that get public benefits. Okay. This slide, before I get to that, shows how when you put money towards poverty alleviation, it works. And there was a lot of money put toward poverty alleviation during the pandemic because so many people lost their jobs and the poverty rate dipped down significantly. The impact on child poverty was quite profound because child tax credits were expanded. Those programs have ended. They were not extended. And so poverty is shooting back up, which just goes to show you that, yes, money can solve poverty. Seems sort of basic, but it is true. And we have the data to show that. Okay. And then my next point, that there are all sorts of benefits that flow to middle class and wealthier Americans, and they are no different than the government giving someone, money on a card to go buy food. They are cash transfers from the government to wealthier people. This is called the hidden welfare state. And this slide shows an example just with regard to housing, such as mortgage tax and property deductions. More is spent on that than rental assistance programs. Wealthier Americans also benefit from tax deductions for childcare, lower tax rates on investment income, Employer-sponsored health insurance premiums are excluded from taxable income. And again, from an economic perspective, these are government benefits and billions of dollars are spent on them. So it's not just poor people who get assistance from the government. It is middle class and wealthier Americans in even much larger dollar amounts.
And just because you don't call it what it is doesn't mean it isn't what it is. And it's almost like purposeful decisions were being made to call things different things so that we wouldn't associate it with negative, the names of these negative programs.
Right. The stigma that attaches. And that's sort of one brilliant stroke was a very effective anti-poverty program is the Earned Income Tax Credit, which gives tax rebates to low-income working families. And it does so quite effectively. And it was very savvy to call that a tax credit rather than cash assistance. And so that program gets a lot less public blowback and pushback than other programs focused on low-income Americans simply because it is called a tax credit, to go to Jess's point there. This is average federal housing spending per household. We spend a lot more on our wealthier families than we do on our poor families. And we need to keep that in mind when poor people are being attacked for being, takers and not makers and that sort of rhetoric that Jess was just pointing about. Okay, our fourth myth is that poor people are lazy and could just lift themselves out of poverty by their bootstraps if they could just get off the sofa and work. We know this is not true. Most recipients of public benefits are working. I know Michelle will talk more about this shortly. If they're not working, it's because they're part of populations not expected to work. Children, the elderly, and persons with disabilities who aren't able to work as a result. This slide shows you that 81% of households receiving federal housing assistance are either elderly, disabled, or actually working. And even for folks who are working due to low wages, we have workers in this country who remain poor. And that's what this chart shows us, broken down by gender and race. You can be working in this country and remain poor. And not surprisingly, those rates are highest for Black Americans and Hispanic and Latino Americans.
And just want to highlight, that's one of the biggest myths that's out there, is that people who get these benefits are not working. And what I'm hearing you say is that the reality is the majority are not required to because they're kids or they're the elderly or they have disabilities.
Right. Or they are working and they're still poor. They still need help to meet their basic needs.
Right.
For sure. A majority of low-wage workers earn so little that they must rely on public assistance to make ends meet. And so this shows you the share of workers who are receiving public assistance who qualify, even though they are engaged in the workforce. One thing that's interesting in the bottom of the slide sort of touches on this. I'm sorry, it got a little cut off, but it talks here about how Walmart pays its workers so little that many of them are forced to seek government assistance. So anyone who is paying taxes into the system is subsidizing Walmart wages. They know they can pay these depressed wages and that their workers will go out and get SNAP, food benefits, Medicaid, and other benefits. And so the safety net is subsidizing low wages in corporate America. So you can consider how you feel about that.
So doesn't every Walmart cost the community in which it's placed an exceptional amount of money because Walmart pays their employees so little that they have to go out and seek benefits?
Yes.
Right.
All right. So although we do have this very strong myth of the meritocracy in this country, this is sort of part of just American ideology. The truth is that your economic chances in life are very much determined by the birth lottery, right? To whom and where you are born. your chances of getting ahead are sort of determined before you even make a single choice. So compare a child born to homeowners in a safe neighborhood may benefit from well-funded schools, their parents' mortgage tax breaks, while a child born to renters in a high poverty area will face under-resourced schools and unstable housing, and these barriers compound over time. So these early advantages and disadvantages just stack up. So what might look like pure merit later in life is often just the accumulated return on an unequal starting line. And what this slide shows is that 43% of folks born in the bottom income quintile in this country stay there their whole lives. And at the same time, 40% of people born at the top quintile stay there. There's a lot of stickiness at the top and bottom of the income ladder is my point. A lot more stickiness that's quite inconsistent with this idea of this meritocracy. And these notions, though, of laziness and deservingness very much permeate who Americans think we should help and who we should refrain from helping. So this is just polling here that shows that people are inclined to be much more generous with either non-cash assistance on the left or cash assistance on the right to the elderly than the blind or disabled, veterans, children. And the least amount of empathy goes to working age adults without children. And these preferences are reflected in our actual public policies. And so this slide is a very, very brief kind of summary overview of how the safety net resulted over time to have very racialized impacts. So if you start in the top left here with sort of the foundation of our social welfare state, this happens during the New Deal. When the Social Security Act was created, which we know has had incredibly valuable impacts for many, many seniors, but to secure the votes of Southern segregationists at that time, lawmakers excluded agricultural and domestic workers. Who were they? Those are sectors where the vast majority of Black Americans were employed at that time. So from day one, the safety net was not a universal right, but a racialized system that determined who could access security and who could not. If we fast forward over toward the right here to the 1960s, the civil rights movement did successfully expand access to programs like welfare or cash assistance, which had originally been designed to serve white Civil War widows. But as the face of welfare changed, the response wasn't just genuine inclusion. We ended up with a lot of surveillance of poor families that continues to this day. Administrators weaponized requirements such as man in the house rules and suitable home rules as a way to police the private lives of Black mothers. This pathologized their families and subjected them to moralistic control that white recipients didn't face. By the 1980s, this surveillance had crystallized into a very powerful cultural stigma. President Reagan popularized the stereotype of the welfare queen, which portrayed Black mothers as lazy and fraudulent. And this was a way of shifting public attention away from systemic economic failures and towards supposed moral failings. It's a way to get the government off the hook for solving the problems that its policies create. And if we move here to 1996, this is when President Clinton signed welfare reform into law. This ended a federal entitlement to cash assistance for poor families. It imposed strict work requirements on families and lifetime limits to the receipt of benefits. And so this law very much codified the belief that poor people need to be corrected through labor and forced into low-wage jobs without adequate support for childcare, healthcare, or education. And Michelle, in a moment, will bring us up to date even beyond this massive shift that happened in 1996. But what we can see throughout these historical time periods that I'm highlighting is very much a line between who is deserving of help and who is undeserving. And we have never been able to sort of get away from that framing of who gets help in this country. And so our policies just reflect these notions. So this slide shows us that Black children are likelier to live in states with the lowest amount of TANF cash benefits. Again, TANF is the name for our current welfare program. And you can see these type of effects across TANF programs. The larger a Black population is in a state, the less generous that state is, and the more strict and stringent its policies are. Okay, and here's our final myth for today, and that's that everyone who needs help is getting it. Okay, and that is not true. Okay, 3 out of 4 low-income, at-risk renters do not receive federal rental assistance. Okay. This is not an unlimited entitlement. We do not have enough housing assistance for all the people who need it. That is a policy choice. You can compare that to SNAP, commonly known as food stamps. Anyone who's eligible will get SNAP benefits. Now, the definition of eligibility changes over time, but it's sort of unlimited. But when we get to housing, it's not unlimited. It's quite limited. And so then we see headlines like this from 2023. Baltimore City at that time had closed its public housing wait lists. They had been closed since 2019. And when they opened them, 30,000 people joined the already 9,000 people who were on the wait list to put their names on the list. So it's sort of the, I think a lot of people may naively think, well, we have a safety net. People get the help they need. People are doing fine. That is not true. And even people who are eligible often don't apply for or receive the benefits to which they're entitled. And part of that is we have a real problem with administrative barriers, sometimes called administrative burdens. All these stumbling blocks put in the way of low-income people to sort of churn them out of this system. So the application process can be long and complex. It can require all sorts of verification documents that can be very hard for people with unstable living conditions to get their hands on. We have websites that crash and are confusing and that don't work. It can be hard to reach human beings because as we've turned to technology to run these programs, staffing at our human services agencies has been going down. We have rules that are unduly complex for all populations that not only do eligible people struggle to understand and comply with, so do caseworkers. Caseworker mistakes about eligibility rules actually generate far more accusations of fraud than anything that applicants do on their own. So anyway, all of these barriers can result in people remaining, in this case, uninsured or experiencing gaps in health coverage. But these types of barriers run across multiple programs involving food stamps, housing, welfare, veterans benefits, and the like. So I will end with that. And I guess my final summary here is that does what we do to fight poverty make a difference? Absolutely. And we need to fight like crazy to preserve it. Are we doing enough as a society to tackle poverty? No, we're not. Could we do better? Absolutely. And that's the fight that everyone here on this call is engaged with. And so at this time, thank you. And I am so pleased to turn it over to Michelle Medea.
Michelle, thank you so much. We got some comments that said this material is it's essential for people to know and understand. We just want to make sure everybody knows that this webinar and a PDF of the slides will be up on our website within a couple of days, so you can access it. And I agree. Yeah, we aren't doing enough. Obviously, this current system has problems, but the system that we do have is lifting people out of poverty. And we are now going to learn about how we are going to cut that system. So I'm going to turn it over to Michelle with 2 L's to take us through the more depressing part of our webinar today. And then before we start talking about some legislation that's coming up, we'll talk a little bit about how this all links to the anti-trafficking efforts that so many of you on this call are engaging in. So Michelle, with 2 L's, take it away.
Thank you. I'm really glad Professor Gilman went first. That was fascinating. And no matter how many times I think you hear the things that she was talking about, you hear it in a different way. And because society is constantly reinforcing these stereotypes and messages, like you can never hear it enough. So I really appreciate how you grounded us in those myths, because unfortunately, those myths are the basis of our public policies today that dictate who gets benefits, what hoops you have to jump through, all the verification you have to show to prove things that you as yourself can just tell the agency. But, you need a third party verification. And so I think really understanding the racism at the root of the programs, the myths and stereotypes about who receives benefits really helps to understand the illogical public policy rules around eligibility. Let me screen share. Let's see. I might need help of which setting to see. Is it viewed by?
It looks good. Just go to slideshow at the top and then click on from beginning.
Okay, thank you so much. And yeah, I think also if we think about these safety net programs that you were talking about as basic human rights, then you wouldn't have all the red tape, all the barriers to access, right? If we understand as human beings, we need food, housing, water, income to meet our most basic survival needs, folks would just be able to access them, and the government is responsible for providing it when someone's unable to work or wages are too low to afford. So I think like having that human rights framework in mind always helps me in terms of understanding why some of the rules are just completely at odds with trying to help folks access these anti-poverty programs.
Well,
so I wanted to
just to start us out, I think, I don't know if we don't necessarily have that framework. I think it just depends on whose humanity is being valued.
Right, exactly. Right, in other countries, public housing, certain safety net benefits, you don't have the same kind of stereotypes, deserving, undeserving, attached, and you see less gaps between people who qualify for the benefit and people who are getting it than you do here. I was actually surprised to see how low percentage of people receive TANF, and part of that I think is also due to how hard it is to access the benefit. So there's such a greater percentage of people who could qualify for it if it wasn't so difficult to access. But I wanted to just segue into my part, kind of picking up with the notion that work requirements don't work. So historically, there was the work requirement in the federal TANF, Temporary Assistance for Needy Families, but not in some of the other benefit programs such as Medicaid. And there was in SNAP, but there were jurisdictional waivers based on unemployment rates. And so the shift we're seeing now with the federal, I'm just going to call it HR1, the bill that passed on July 4th, 2025, and is now law, a big part of that is baking into these benefit programs that really are entitlement programs, different eligibility factors to cut people off. And one huge part of that is work requirements. So just starting off before we jump into what HR1 does, the idea, which we don't agree with, but the idea, I guess, to justify a work requirement is that, the purported purpose, I guess, is to improve employment outcomes, that if people could just get connected to jobs, they wouldn't need, federal assistance for food, for cash and whatnot. But the data shows completely the opposite, that work requirements are ineffective. They don't lead to better employment and economic outcomes. They don't move people out of poverty. They don't eliminate the need for medical assistance, for food assistance. And I think similar to what Professor Gilman was saying is, these safety net programs subsidize low wages. And so even if a person is able to work, they probably have multiple low wage jobs and live in housing that's not affordable. So a huge percentage of their wage goes to afford housing. They probably qualify for different public benefits. So I think, work requirements just create additional barriers to accessing benefits and result in denials, result in unlawful terminations. And it's really important to keep in mind they are rooted in a racist history and assumption. And I actually have, I'm not going to put it in the chat now, but just please remind me at the end. I have there's a lot out there on this, but 2 really good articles around the racist history and legacy of these the cash benefit program and just work requirements generally, starting with slavery, tracing up to what we see today. And it's really appalling.
I'll include them in the email to all the participants.
Okay, perfect. Thank you. But these it's relying on these harmful assumptions that people who receive public benefits are able to work and are just lazy, choosing not to, and must be coerced by public policy to work to be deserving of healthcare, food, cash assistance. So, I think as advocates, a very basic thing that we can do is disrupt and interrupt and flip the script on these harmful stereotypes when we're talking about different public benefit programs, whether it's in front of a judge on behalf of our client who was terminated, or in Annapolis, in front of the Maryland General Assembly, or wherever we are in our, written comments on federal proposed regulation. We can do our part to not reinforce these assumptions and stereotypes and actually interrupt them, correct them.
With our friends and family.
Yes.
Sorry, I'm never going to let that one go. That's
where sometimes be harder, right? Yeah.
The people on this call do work, at work, but there's work to be done outside of work.
I also think it's important to discuss it with clients at times too. You know what I mean? Like, this is something that folks are placed in and trapped in, in a very intentional way. And sometimes acknowledging that, you know what I mean, when you're discussing different needs and plans for whether it's, social service help or case, legal goals, that acknowledgement sometimes can mean a lot and can help people have confidence going forward with what they're trying to achieve.
Totally. I think, all the shame that's baked into the system that, by the time someone comes to one of our organizations to request legal representation or assistance, they've already been, wronged through multiple different systems, shut out, the process of applying for these benefits. You spend days at the Department of Social Services, and the interactions are not trauma informed. Mm-hmm. You're, questioned and asked things that are very personal and might not even be relevant or necessary, but just, it's completely dehumanizing to even apply for these benefits. And I think those myths kind of go into all the interactions, so that by the time someone even gets to us, if we can show that we, don't agree, don't buy in, whatever we can show to kind of give a little bit of context around how we view these benefits as they are entitlement programs. They're basic needs that, it shouldn't matter.
Exactly.
What
reflecting that to them, like we, like I see you, I see what you're trying to do. I understand the challenges that you're navigating through. I think it can be a powerful thing to build your relationship with your client and just, yeah, give some recognition.
Yeah. I have a lot of experience working with people who have been unlawfully denied or terminated from TANF. And so I just wanted to give a quick example. I have so many, but I'm going to give one example that really shows how, the work requirement just is a barrier to accessing the benefits. So years ago, I worked with a client who, as a condition of receiving, in Maryland, it's called temporary cash assistance, TCA. As a condition of receiving TANF or TCA, she was required to do a work program. And a lot of times there's different categories of what types of work could count. And one of the things that could count is called work experience, which actually is the opposite, but it's basically an unpaid work assignment at a place that it could be, a hospital, could be a corporate, I don't want to name, you can imagine, places that you get food quickly from or packages quickly from, all the various types of employers actually are part of this system where people who receive TANF are required to do a certain number of hours. Usually they're referred for 40 hours a week, even though the requirement is 20 to 30. Most people are just referred and required to work 40 hours a week at a place that alongside people who are receiving, minimum wage salaries, paid time off, health insurance. So it's extremely inequitable, and the actual substantive skills are not helping folks be able to transition to paid employment. So we did, through a Public Information Act request, learned that of all the employers in Maryland who had people working for them who received TANF and no wages from the employer, less than 1% of the employers ever hired the folks who were there on work activity assignments through TANF for paid employment. And so there was legislative reform to make limitations on when that type of work activity can be used. And that was a great step. But the case I wanted to highlight was a client who on her own found she didn't want to do the unpaid work experience. She found a training program. I think it was like biotech or bioservices, where at the end it was certificate based. So if she completed it, she got a certificate, had nothing, she wasn't referred there by the department, but she was able to use that towards counting. And she was doing the program, completing the number of hours. She received TANF, and she was asked to send her timesheet in by email by a certain time every Friday. And so Friday came along, she sent the email and said, attached is my timesheet, except she forgot the attachment. And, how many times do we do that? I definitely do that, right? She didn't realize, right. She didn't realize the attachment wasn't there. She sent the email. Tuesday gets a reply, your TANF case is closed. She comes to find out it was because she didn't attach it. She attached it. So she had a signed timesheet showing she did the work, but that wasn't good enough. We had to go in front of an administrative law judge, have a hearing. Of course, we received a favorable opinion because she completed the work program, and under the regulations, the termination was unlawful. But it was the gap of income, really set her back, because then she didn't have the income. It took 2 to 3 months to get the decision. So that's 2 to 3 months without income. You miss your rent payment, and then now you're facing eviction. So the whole, her financial and housing stability was completely uprooted by this work program that she was doing. And like Professor Gilman mentioned, there are a lot of people who are unable to work, whether because of a disability or many other reasons. So yeah, I probably spent too much time on this slide, but if you take anything away from today, work requirements don't work. Let me check the time, actually. All right, Jess, feel free to speed me along as facilitator, but I'll try to get through this quick.
You're okay.
So we have
Once you
time
get
for
through
questions.
this, the going through how this connects to trafficking is not going to take us that long because it's all overlapping.
Okay. So wanted to give, even more bad news, but an overview of the impact of the federal bill that is now law, HR 1, and it's massive, and there's so much in there and so much harm. I'm only going to focus on a very, portion of what it does, focusing on SNAP and Medicaid. So in Maryland, there's 1.44 million Marylanders who their health coverage is through Medicaid, and there's 693,000 Marylanders who receive SNAP assistance. And so just as a general overview, HR 1 increases Maryland's cost of administering these programs. It implements harsh work requirements. Like I said, the Medicaid didn't have a work requirement, and now it will in the future, and SNAP had one, but Maryland for years had statewide waiver due to unemployment rates and then jurisdictional waivers, and it's even harsher than it was, and it further restricts eligibility for lawfully present immigrants. So just to look at the financial impact of HR 1, and I think Jess said the slides will be available, but prior to HR 1, the federal government paid 100% of the actual benefit that people who receive SNAP get, the benefit that trickles down to people we want to get it, the federal government paid that. Now, beginning in federal fiscal year 28, states will be responsible for a benefit cost share payment. It's based on the state's error rate. If a state overpays or underpays someone, there's a calculation. And so Maryland's error rate, the most recent payment error rate is 13.64%. So the Department of Legislative Services estimates Maryland would be responsible for $144 million in FY28, $200 million in FY29, just based on that part alone. And I should have mentioned, there wasn't room for all the sites, but the information and the stats and data, and I can include it in what I send Jess, comes from the Department of Legislative Services recent presentation in January to the General Assembly on the impact. It comes from the Maryland Department of Human Services and Department of Health estimates on the impact. It comes from Center on Budget and Policy Priorities, and a little bit on Medicaid came from the National Health Law Program. Another big financial impact is just the administrative cost shares. Previously, it was 50-50 between the federal government and the states, the cost of running the state agency to administer the benefit. And now that will shift from 50%. Maryland will be responsible for 75%. And then of course, administering the work requirement. So, staff to refer people to different work programs, to collect the timesheets, to monitor compliance, to cut people off benefits. And then when people reapply, to re-enroll. So it's called churn, where someone's cut off, but they actually are eligible, so they reapply. You now have to process the termination. Then you have to process the new application, and just increased, technology. So computer codes to do the work requirement now, staffing. So all of this is going to create just such a big cost for the Maryland state budget. So this is cut off. But the ABOD, which is a federal term, stands for able-bodied adults without dependents. So historically, and this comes from federal law, with the SNAP program, if you are an able-bodied adult without dependents, you could receive SNAP for 3 months in a 36-month period. And beyond that, you would need to be either working or an employment training program for 20 hours per week or 80 hours per month. Otherwise, qualify for an exemption. And so the impact of HR 1 is it removes several categories of exemption. So if you're experiencing homelessness, a veteran, if you are under age 25 and aged out of foster care, previously those were exemptions from this work requirement, but as of HR 1, effective, I think it was November 1st, no longer. Individuals aged 55 and older used to not be considered ABODs, but now that increases the upper age limit to 64. And for parents with caring for children under 18 were previously exempt, but now if the child is 14 and older, those families are no longer exempt. There might be more that got cut off.
If I am experiencing homelessness, I am now expected to be working in order to get food.
Correct. Yeah. There is an exemption if you have a disability that impacts your ability to work. So there might be, yeah, another exemption, but right. If you are experiencing homelessness, that is no longer an exemption for the SNAP work requirement. My titles are blocked, but another really devastating impact of HR 1 is the immigrant restrictions. So it already was before HR 1, there already were very strict restrictions on different immigration statuses and who qualifies and who not. And again, going back to thinking about deserving, undeserving, benefits as human right, like food access as human rights. You know, if that was the framework, we wouldn't have these arbitrary distinctions on, you know, based on your immigration status, whether you qualify for food access or not. But under HR 1, a number of immigrant statuses that were eligible for SNAP no longer are. So the I think big ones are refugee, asylee, certain other humanitarian parolees, and lawfully present non-citizens. So there's only 3 categories of immigration statuses that qualify for SNAP and Medicaid under HR 1. It's lawful permanent residents. And I think for SNAP, at least, you have to have the LPR status for at least 5 years before you even can qualify for SNAP. And that was pre-HR 1, but lawful permanent residents. The next one is certain Cuban and Haitian immigrants. And the last one is an individual who lawfully resides in the US under COFA, Compact of Free Association. So it was 3 very kind of narrow categories, and everybody else is no longer eligible. So just to give a stat, in federal fiscal year 24, Maryland had 2,912 refugees, 2,094 asylees, and 2,641 humanitarian parolees or others on special immigrant visas. So those categories of immigrant statuses, you know, as long as they were eligible otherwise for SNAP, no longer are, just because of HR 1. Switching over to Medicaid, again, the impact on healthcare is much wider than just Medicaid, but Medicaid, a lot of people in Maryland are going to be, you know, uninsured as a result of HR 1. So there's a work requirement that will, the other thing about for the Medicaid is there's varying implementation dates. So they vary from FY26 to FY34, but the majority of funding loss due to this takes place in FY27 and FY28. So there's a Medicaid.
That's purposeful, folks, so that it doesn't hit before midterms, which are in November. That was purposeful, just so no one has any mistake about that. So that this doesn't hit before these folks who enacted this are up for re-election.
Exactly. So the work requirements, which take effect, you can see on the slide, the effective date, January 2027. States can extend that out by certain requests and processes, I think till January of 2028, December 28 of 2028. But states can also implement it sooner. So I think well, we could talk about advocacy later, but reduces retroactive coverage from 3 months to 1 month prior to application for ACA expansion adults. That's Affordable Care Act expansion adults, and 2 months for other participants. I guess one thing to keep in mind with the Medicaid cuts is a lot of it is intended to, or a lot of it is affecting the ACA expansion coverage, which was, the Affordable Care Act expansion. So prior to that, it was really difficult to get Medicaid coverage. Medicaid coverage was really based on a very strict criteria of proving through documentation that you had a disability and how it impacted you. The ACA expansion allowed folks to access Medicaid if they fell below a certain income level. So a lot of these, the work requirement, and a lot of these kind of cuts to Medicaid are specifically for the ACA expansion population. So it also removes the coverage from non-citizens. Those 3 categories for SNAP are the same that would apply for Medicaid. Eligibility redeterminations. So when you're approved, you're certified for a certain period of time. Usually it's 12 months. And this would make it so that you have to recertify your eligibility every 6 months. And for folks who practice in this area, we know that so many people get cut off at redetermination because of, missed paperwork, agency not sending out the required notices, going to an old address. There's so many reasons that folks who are eligible and should, get coverage just get cut off at redetermination. And then you have a lapse in coverage when you have to reapply, wait 30 days to hear. And now looking back to the second point, retroactive coverage is going to be even less.
And just to highlight, it removes coverage from victims of sex and or labor trafficking as well.
Mm-hmm.
Removes coverage. Got it. Okay.
Mm-hmm. For if that, that was for immigrant status. Yeah.
Immigrant.
Yep.
Sorry.
And then just, looking at numbers, it's estimated 5.3 million nationwide will become uninsured due to the Medicaid work requirement policy alone. And the Maryland Health Department estimates 175,000 Marylanders will lose coverage. And I have some other stats there. Oh, that was it. All right. I'll stop the share.
Okay.
Thank you.
So that just made me feel the rage. Thank you for that, Michelle, very much, even though I'm having trouble gathering my thoughts. Heather, if you could pop off mute. I just this isn't going to take long because there's so much overlap, but if we can just, you and I just pop some experiences back and forth. We're talking about food insecurity increasing, right? We're talking about homelessness increasing. We're talking about people losing their health care and their cash assistance. And we're talking about poverty skyrocketing as a result of this, of HR 1. I'm not going to use that ridiculous acronym.
Yeah.
And so, I think we can kind of pretty easily just give 2 minutes on how those things in general feed people into the exploitation machine, right?
No,
Like,
of course. I
you
mean,
want to start us off?
Yeah, I wish these statistics and these slides were on billboards, all over the country, all over our state, so that people would understand just the huge impact and the layers of impact, right? It's it's on food, it's on healthcare coverage, it's just chipping away at folks' safety nets. I mean, I would even say that there isn't really. I feel like it's a misnomer to even call what we have in this country a safety net in some ways, because it's gotten so thin that I feel like people are just in this place of precariousness all the time. And when I think about the clients that we've worked with, particularly some of the folks who have been exploited in the past, who are trying to move past their experience of being trafficked, rebuild their lives. and they're accessing these benefits to be able to have some stability, to be able to have some time and some security as they're, if they're working with a program, while they're getting through a program, if they're doing some kind of job training, if they're just applying for things. I'm trying to get some stability, and knowing that a lot of this is going to be undercut from them, or even if they're managing, that they are just one, not even a big disaster, some small unexpected expenditure, some, what I mean, some hurdle or
One missed
roadblock.
attachment on
One
their
missed
email to
attachment.
their
Exactly.
to
Like,
use
and
themselves
something
example.
that an administrative error, that
One
missed
administrative error
attachment,
away.
that, yeah, or missing, we see this in the context of like criminal record relief. You miss one appointment with a probation officer, right? Because the bus didn't come. Like, it's kind of the same thing with these benefits, right? And it can derail someone's progress. And as Jess and I say all the time, like, the underground economy is always there. Like, people who are looking to exploit people are always ready with solution to tide someone over, with, some option that could potentially ensnare them back into a place where they are being exploited. And I want to take those statistics and put, we're putting 175,000 people and so many thousand people, like, again, in a situation where they are going to be more vulnerable to exploitation. And that's what I hear.
Trafficker, I'd be celebrating this.
I know. And that's what I hear when we're working with people on any of their legal issues. Often they're kind of falling in and out of these places of stability, right? And when they're not in a place of stability, that is when they are, just being made so much more vulnerable to exploitation and to trafficking. And I just, it's really hard. It's really hard to hear all this information, even though about it theoretically, like, to see the statistics, to see the numbers, to know how we're being impacted here in Maryland. And I will say, I do feel like Maryland is a state that has, some more protections than other states may have. And I worry about not just our states surrounding us, the whole country, and how this is going to give more opportunities to traffickers to really prey on others.
Yes. And just to kind of, I think that's a good kind of philosophical piece, but let's just break this down. Folks are going to be obtaining services on the black market, right? That are unsafe and unhealthy. They are going to be entering into unsafe or exploitive relationships in order to get their basic needs met. They are going to be obtaining employment on the black market, in the underground economy, in order to get their basic needs met. They are going to be obtaining employment in illegal, whether you agree that certain things should be illegal is a different question, but currently illegal employment sectors in order to get their basic needs met. They are going to be committing criminal acts in order to get their basic needs met. And that gets you involved in all other kinds of systems, right? They are going to be put at high risk for people who are going to scam them with ways to get access to programs and food stamps and things like that. They're going to be selling access to the access that they do have, and just all of those places are where folks who do not have other folks' best interests at heart are. It's not that complicated. And so I appreciate your concern for the folks that we're already seeing. What I'm seeing is a funnel of new people,
of course,
into these individuals as well. And all of these, and then just the thought of immigrants who are already living underground as a result of the horrific invasions into our communities that we're seeing with the government right now. Now they're having the one piece of stability that they have ripped away from them as a result of HR 1. I think what upsets me more is the stunning hypocrisy of a government an administration that kind of rode a partial ticket on how much it cares about human trafficking survivors. And this is going to create more victims than I think we've ever known what to do with. and in combination with cutting funds to human trafficking organizations, to cutting funds to who we can use our funds on, to cutting essential information out of the trafficking in persons report, to cutting the trafficking in persons department. I'm furious in a way that I haven't been in a long time. And we have,
Right.
regardless of your politics, this is reality. This isn't about politics. This is about the reality of what we are dealing with, and what we are going to be dealing with as anti-trafficking providers once these policies go into effect.
Yeah, no, exactly. There's going to be an entirely new flow of people that are going to be exploited. And I worry too about people just getting extremely trapped. There's a spectrum and a line between labor exploitation and labor trafficking. If you are so concerned about, reporting unsafe work conditions because of the impact that leaving a job or complaining about a job may have
Not
on
going
other
to
safety
anymore.
concerns. Yeah, I mean, we could go on and on about this, but I think that there's just places where it's going to be hitting people in so many different ways, and it's going to really lead to people walking this tightrope more so than they have been, and more people walking this tightrope where, again, one thing can tip them into a place where they have to be pursuing riskier options to be able to have anything in their life. It's really frustrating, and this goes beyond any kind of
Has
political
nothing to do
discourse.
with
This is
politics.
I want to go back to what Michelle said, or double
Which
Michelle,
one?
that we should be talking about this in a basic human rights framework, not as an entitlement, not as a who's deserving, who's not to create such administrative or other hurdles that blocks people from getting this. These should be some fundamental basic human rights. We should have a floor in this country. And what that floor would do is prevent people from being exploited. Like we do, every chip and every lowering we do of that floor is just making more and more people vulnerable.
And then I think that just the last thing I want to say before we talk about some pieces of legislation that folks can keep an eye out, and we will also include information on this as well. People are going to die. And they're going to die cruel deaths, because they are going to die on the streets. They are going to die of hunger. They are going to die of untreated health conditions. They are going to be murdered in scenarios where they were unsafe. So they are going to die of preventable conditions, whatever you want to, whatever that condition may be. And they're going to die of preventable conditions in the richest, most prosperous country in the world. And we should all be ashamed of that as human beings. The Michelles, I don't know if you have any thing that you want to add to my rant. You're perfectly, you want to take yourselves off of mute, you can. If not, Michelle M., you can get us going with some pieces of legislation that we should be watching out for.
Professor Gilman, did you have anything you wanted to? Okay. And do we want to do questions?
Like she probably agrees with everything that I just ranted about.
Because I can send stuff around too in the materials. Do we
Sure.
want to look at questions? Because I know
we don't have had a few. We've been able to answer them. Yeah. So if you want to just tell us a couple of bills and what they are, we will take it upon ourselves to, grab, descriptions of those bills from the website and send them out. But if you could just give us a couple of things that we should be looking at that have to do with what we're talking about today, that would be great.
Okay. I think probably the main thing is just looking out for budget cuts and, defending. So maybe, advocacy around maintaining the social safety net programs and funding that we have. So with, all the cost shifting from federal funds for these programs that are now going to be on the states, Maryland's going to have to pay several $1 million more per year to administer the programs, to provide the benefit than historically it was used to. So I think that's probably going to be our main focus is, when different agencies, have to produce a budget, and then there's public hearings. So there's opportunity to either go in person or testify in writing or both, or, even contacting your elected officials in Maryland to talk about why continuing to fund the social safety net programs is so critical, and how there shouldn't be funding cut. Some programs have additional features on them that are state funded that we'd like to see continue. And so I think we'll have more information when we see, the different agents, like the Department of Human Services budget, Department of Health budget, to see if there are proposed cuts to Medicaid or SNAP or TANF that, we would want to advocate against, or just it could even help to, it certainly would help to advocate, alongside the agency for continuing the funding that they get. So there are different advocate groups and coalitions kind of working on that. So if that is something folks are interested in, can reach out to Jess and we can get you connected so that you're not necessarily trying to navigate. I would not know how to navigate the budget if it wasn't for, I have a few advocates in mind who I learn everything from about the budget, because there's just the process and timing. So it does help to kind of get plugged into different advocate groups that are kind of in Annapolis all the time, monitoring this stuff, know the deadlines. So I'm happy to get folks
Can
connected.
get on some listservs maybe. So
Yep.
if you could send us some great listservs, that would be really good.
Sure.
Are any organizations advocating for maybe cuts to some programs that fund folks that maybe don't need it as much?
I don't know. I don't know if I'm reading between the lines of what your question is, but I don't know.
Are there cuts, that Professor Gilman talked about, programs that fund, benefits for folks who are not in need? Are there any pieces of legislation that are focusing on, either taxing or cutting benefit programs for folks who are not, at risk of losing SNAP benefits or housing?
I saw you came off mute.
I'll just say HR1, like we didn't show the companion slides of all the massive tax benefits and subsidies that flow to the wealthy in this country at the same time that we cut the poor. And is there a movement to
At the state
claw
level?
those back? No. That's all.
Well, I feel like that's a little bit more at the federal level than at the state level. You know what I mean? That the way that those benefits are flowing. But I do think, all the folks that are here today, like we can bring that unique perspective though. It's not just, the kind of most obvious ways that these cuts are going to be helping people. We're working with folks who are, again, being placed in these extremely vulnerable positions, who have experienced human trafficking, domestic violence, sexual assault, all of these victimizations that, again, taking steps forward from that often requires help. And so we should talk about and bring the perspective of, our clients, of what we're seeing, how it's going to be impacting people, and how it's going to be putting more people at risk. Again, if you don't think you're going to be able to have food security or afford an apartment, are you going to be able to leave someone who is abusing you or exploiting you? Like that becomes a calculus with a lot of the clients that we're working with, and being able to share that message with legislators about this, this the many ways this broad impact is going to be hurting people here in Maryland. That's a really important thing that we can do. And it does bring a little bit of a unique perspective and, hopefully a compelling perspective to the legislators that you're talking to.
Right. And so for those of you who are on this webinar, think about ways that you can maybe start, collecting some of that information and passing it on to the folks like Michelle who are doing that work. And, getting that information in writing when these budget cut talks, eventually do pop up. That's important information for legislators to know. I mean, I always say this to clients, like, when they're like, well, what do they care about what I have to say? I'm like, let me tell you something. They are so sick of seeing our faces pop up and hate everything. Like they really are sick of us. And what makes way more of a difference is what our clients have to say than what the talking heads have to say. So
And
that's
you can
something.
do that via written testimony. You can give that compelling story and then flag for the advocates that are able to make it down to Annapolis, you know, I mean, what you contributed, and they can try to elevate that. I mean, we all can play a role in this.
Michelle, any other things that we should keep our eyes on, or is just the budget the main?
I think, you know, we're seeing new bills introduced every day. So not everything is out yet, but be on the lookout for more to come. I can provide more details. But I do think, you know, also looking at making some of the programs easier to access. So even if you're not increasing the benefit, if you're decreasing barriers to access, then more people can qualify, stay on the benefit. There's probably going to be a bill looking at expanding good cause reasons to not have to comply with the child support requirement in the temporary cash assistance program, which is, again, one of those very kind of oppressive behavioral requirements that actually limits a lot of people from even accessing the benefit who do qualify. So there's a number of housing related bills too. I can send around, we have a one pager, but you know, bills that would be requiring good cause to evict, and one on rental assistance program to fully fund community schools. Another one on ensuring applicants for rental housing are treated fairly in terms of like what they're asked at the application stage to even qualify or to get on the wait list. So I can send around a one pager that kind of describes all these different initiatives. But I would just encourage folks to think really broadly around, you know, kind of all of these different, you know, advocacy efforts, because if you no longer qualify for SNAP or Medicaid or both, you now have to divert, if you have any income, that little income elsewhere. So it's all kind of related, right? If you have, you know, if I don't think this is the audience, I need to kind of break it down. Everybody gets it. But it's, our clients and the populations and communities we're working with are kind of experiencing many different systemic barriers and inequities. So really kind of any anti-poverty initiative might have an impact.
And, you know, kind of the last thing I'll say is, Heather, people have heard Heather and I say this all the time. When you are doing anti-poverty work, when you are doing anti-homelessness work, when you are doing the type of work that Michelle is talking about, and when you are kind of undoing those stereotypes that Michelle Gilman talked about, you are doing human trafficking prevention work. So we encourage you to get involved in this work. We will send around some websites and listservs that you can get on, so that at least you can monitor what is happening. And again, we will follow up with all of these. I've been taking notes on all of the stuffs that we have to send all of you. And I just want to take another moment to thank our two presenters, Professor Michelle Gilman from UB Law, and Michelle Medeo from the Public Justice Center. We can't thank you enough for this incredibly enlightening and depressing subject matter presentation. Thank you so much for taking several hours out of your afternoon and spending it with us. This webinar is recorded. It will be uploaded and accessible through MVLS's Human Trafficking Prevention Project website, along with PDFs of the presentation. So you can actually have those statistics at your fingertips. And then we will follow up with all of you via email with a survey, as well as these follow-up articles and clips and all of those things. And with that, we bid you adieu this afternoon, and I'm going to stop the recording. Thank you so much. Have a good rest of your afternoon.